Dr. Jason Steinle. I'm a chiropractor here at Health and Harmony Chiropractic and Wellness Center. And this year marks our 20th year here in Evergreen. I founded Health and Harmony back in 2001. And we really founded the office on the principle, the idea that we want to add life to your years, but also years to your life. So not just adding years to your life, but adding life to those years, just helping you have a better quality of life. And through the last 2 decades, that's really something I've seen with patients coming in. It's more about just being able to get the most from your life. That's what's important, that quality of life. This is my family, my beautiful, smart wife, Mandy, and our 3 children. And, one of my big goals, health goals, both short and long term, is that I'm able to actively run circles around my children and my grandchildren. And so while right now that's pretty easy to do, I know that in 5 years, that's going to be a lot harder as they grow up. And in 30 years with my grandchildren, that the choices I make today, the health choices that I'm making today are going to impact whether I'm going to be able to do that in 5 years or 30 years from now. How many of you made resolutions for the new year, for 2021? If you did, if you just would just write it, say yes in the chat box. Now, what we're doing this year in the office is we're calling this the journey. And the step 1 of the journey is this 10-day detox that we're starting on Sunday. And we're calling it the journey because if all you did this year was this 10-day detox, well, that's a good start to the year. That's not really going to help you move the needle to help making 2021 one of your best health years. And so the journey means this is step 1 of a number of steps we're going to help take you through to make this your best health year yet. There's this expression that it's not about resolutions, but about creating healthy health habits. And that's really our goal, is not to make it something that you have to force yourself to do, but instead something that as you do this, it just becomes a part of your life. It just becomes a part of your lifestyle. And I know looking back at the last year, one of the big lessons that came out of 2020 is that health is wealth. With COVID, with coronavirus, it doesn't matter where you live, what kind of car you drive, where you went to school, is all of us were and are at risk of getting coronavirus. But what came to the top is what's most important is just your level of health. Those that are healthier had less of a risk of really getting sick with COVID. Those that had poor health had a greater risk of ending up in the ICU or never coming out of it. And I'm just interested, and I'm still having a hard time getting my chat working here to see all of you. How many of you either have gone through, had COVID this last year, or know somebody that had COVID this last year? Yeah, and just if you would write it in the chat, how many of you knew somebody that when they had it, it was really mild? It was more like a cold, like allergies. And how many of you knew people that when they had COVID, that it was really challenging, like they ended up in the hospital or maybe even died from it? There's a term that came out of last year called comorbidities. And what comorbidities is that the people that had more than one health problem, so if you had high blood pressure, you were overweight, and had diabetes, you were a lot greater risk of becoming sick with COVID versus people that didn't have those health complications. And it really became personal for me in December, where there's a friend of mine, he's a colleague, he's a chiropractor that practices in South Dakota. And I've really gotten to know Justin over the last 10 years because every Monday morning, Justin and I and 2 other doctors, we have a phone call. And over the last decade, there's been a number of times that Justin's talked about how he just can't reach his dad. Like he shares health advice to his dad, but his dad never listens to it. Um, and I'm sure some of you on this call can relate to that, whether it's your wife or your husband or maybe a brother, where you know there's things that they can be doing to help their health, but no matter what you say or share, they just don't listen to you. And so that was Justin's experience with his dad over the years. His mom, on the other hand, she's always really taken what he's had to say seriously. She even helps him sometimes in the office. So in December, early December, both his mom and dad tested positive for COVID. And his mom was able to recover in a pretty short period of time, but his dad ended up in the ICU. And while he was in the ICU, when I was talking to Justin, he shared with me something that it just struck me. And it was that he said, you can't make health decisions when you're in the emergency room. In other words, you just don't make health decisions when you're in the ICU. That's not the time that his dad should be focusing on doing a detox. It's not the time his dad was going to be trying to elevate his vitamin D levels or get his inflammation down. In the ICU, he's just trying to survive. But instead of his dad had made the decision in January of 2020 to do a detox, to start focusing on the journey, there's a great chance that he would have never ended up in the ICU in December. And the sad part about this is that he stayed in the ICU for several weeks, and then he ended up passing away just before Christmas of this year. He was never able to leave the hospital. And so it's really become a mission for me this year, because I know on the call coming into the office today is that, you're somebody's dad or you're somebody's mother or brother and sister. And this is our time right now to make health decisions that are going to impact us next week, but also next year and 30 years from now. So today you're going to learn why this 10-day detox is important. We're going to talk about how to actually do the detox. And then we'll also look at how do you take the momentum that you're going to create going through this detox and be able to take that momentum into the next steps to make 2021 your best health year yet. So congratulations. If you're on this call, you're somebody that's already signed up. You're going to be starting the detox. And we're going to start the detox this coming Sunday. So it goes for 10 days. This kickoff day is this Sunday, which is January 10th. And it's going to go from the 10th through Tuesday, the 20th. And what this detox is that it's called a metabolic detox. So what it's not is that this is not a juice cleanse. It's not a starvation type of program where you're only eating lemons during the day. It's not one of those detoxes where you're going to be glued to the bathroom and not be able to just function throughout the day. But what a metabolic detox is, it's a detox program that's designed to help drive what's called phase 1, 2, and 3 detox processes in your body. And it was developed by a company called Metagenics, and they've been around for over 30 years. And they're really one of the forefathers of what's called functional medicine or functional health. And functional health looks at how can we use our diet, our lifestyle, and supplements as the first line treatment. So whether it's heart disease or diabetes, or you have a cancer risk, or you have inflammatory or arthritis, using your diet, lifestyle, and supplements as your first line treatment before going to drugs or other types of interventions. So as we're going through this 10-day detox, there's going to be two big benefits that I expect you're going to get out of this. First one is actually the detoxification process. And so we just came out of the holiday season, right? We went from Thanksgiving, Christmas, New Year's, and here we are on January 5th with our call. And during the holiday season, we often will end up eating a lot more sugars, like cookies, cakes, different treats, drinking more. It's easy to let some of our exercise slide, especially as the weather gets colder and the days get shorter. So in going through the holidays, we can start to build up more of a toxic load in our bodies. Often I'll hear it in the office, patients will feel sluggish, wake up without the energy, without the motivation that they do other times of the year. The other part of this is that we just live in a world today where we're surrounded by a lot of toxins in our environment, in our air, through the paint coming off, our carpet, our clothes. And then this last year, especially when you start considering all the cleaning that we've been doing with Clorox, Lysol, the hand sanitizers. And so all of these things can also create a toxic load in our bodies, which our bodies are designed to eliminate out of our bodies, but at times it can get overburdened. And so this 10-day program is designed to help support your body to naturally detoxify itself. So when these toxins come into our body and we're not able to eliminate them immediately, and we do that normally through urinating them out, through bowel movements, or through sweat, they get stored in our body. And toxins get stored in fat. They're lipid soluble. So once they get stored in our fat, which also includes in our brain and in our nerve sheaths, they're very hard to get released because once they're lipid soluble, they don't just freely circulate. So the process that we go through with this phase 1, phase 2, and phase 3 is the first part is we begin to reduce the amount of stress we place on our bodies. And we do that by limiting the foods that we're eating. So obviously from the beginning, we're not having alcohol. If you smoke, we're not going to be smoking during the 10 days. There's no energy drinks. We stop with coffee, energy bars. And as we go through the program, starting from day 1 until we get to days 5, 6, and 7, we gradually are limiting the foods that we are eating. It's never limiting the number of calories, just the types of foods. And we'll go through that in just a moment. At the same time as we're going through and reducing the load on our bodies, we begin taking 2 things that are in your kit. One's called Ultra Clear Renew, and the other's a product called AdvaClear. And the Ultra Clear Renew and the AdvaClear help drive the body's detoxification process. So we're freeing the toxins from being in the fats, from being lipid soluble. Once they're freed, we bind them to a molecule that's water soluble that then can circulate in the body, and then with the liver and the kidneys, it's excreted in our urine, in our stool, or through sweat. And so the metabolic detox, as you go through from day 1 to day 10, you're going to have this cleaning of your body to create a clean slate. The other big benefit, and you'll see this with this slide, as we get to days 8, 9, and 10, what I've seen with patients is that they begin to experience more energy, more clarity, meaning that if it's been difficult to concentrate, there's been a fogginess, that lifts. We see a weight loss, especially as the inflammation starts to decrease in the body. We see that the body just starts to lose water, starts to see more of a weight loss. And the big thing is that these last 2 things is you'll find a decrease in cravings, especially if you're somebody that has a history of cravings with sugars and coffees, caffeines, is that as we get through this detox, at the end of it, you'll just find yourself not being called where you just need to have that candy bar or need to have that energy bar or the coffee. And that's where it really becomes a springboard into making healthier lifestyle choices, because you're not using your willpower, but instead it just becomes something like, you know what, I just don't need that. I don't crave it like I used to. And so cleaning the body, but then also getting the cravings down, those are 2 of the big benefits that I expect that you're going to experience as you go through, and especially as we get towards the end of the detox in days 8, 9, and 10. So what is the detox kit? Most of you at this point have picked up your kit. We still have a number of them here with your names on them for those of you that haven't. And please do pick them up by this Thursday so you can have it before we start the program on Sunday. And in your kit, you're going to see that there are a number of things. There's this shaker cup. And if you've never used one of these before, inside of it is this metal ball. And what that shaker cup allows you to do is that when you're on the road, if you want to make a shake using the medical food, which is this Ultra Clear Renew, you can put it in there with water, one of the milk substitutes, and then shake it up so it dissolves it, breaks it up, so it's just easy to drink and have with you on the go. There's a bottle of Ultra Clear Renew, and that's this big bottle that you see pictured here. And that's the medical food. And as we're going through this 10 days, initially you're not taking this at all. Starting on day 2, you're going to be taking 1 scoop twice a day. And this is all written out for you in the booklet. And then once we get to days 5, 6, and 7, you're going to be taking 2 scoops of this 3 times a day. And this is what really helps drive that phase 1, phase 2, and phase 3 of the detoxification. At the same time that you're taking this, you'll start taking this other product that's in your kit called AdvoClear. And AdvoClear helps drive the phase 1 and phase 2 of detoxification. So these are things that are in your kit that you'll be taking as you progress through the 10-day program. You'll also find inside your kit this booklet, which is called the Clear Change 10-Day Program Guide. And this is something that I want you to really get familiar with. Inside of this program guide, there's a list of foods that you're going to be eating as you go through. And then it also lays out for you day by day the steps that you're going to be taking. So once you have your guide, and if you do have it right now, I just encourage you to pick it up and take a look at it. On page 4 of your guide, this is an overview of the entire 10 days. So on page 4, it's going to take you through what you're eating on each of the days and how much of the medical food you're taking and how much of the AdvoClear, the supplement that you're going to be taking. When you move forward in your book to pages 6, 7, and 8, this is a list of all the recommended foods that are in the program. And so anything that's listed on page 6, 7, and 8, these are the recommended foods. So starting on Sunday, day 1, you can eat anything from these 3 pages. What you'll see that's not included on these pages are what we talked about earlier. There's no alcohol, cigarettes. Also, there's no processed foods like energy bars, cereals that are real simple, sugars. And this will be a big one for many of you, there's no coffee as we go through this 10-day program, even decaf. And so there's green tea, any herbal teas, water, but we're going to eliminate coffee from the beginning as we're progressing from day 1 through day 10. And then moving into Monday, which will be day 2 of the program, you'll see how it's listed in here. On day 2, you're still eating everything from this list, but that's the first day that we'll start taking the medical food and the AdvoClear supplement. Once we get to days 3 and 4, then we start eliminating certain foods that you're eating from this category, and it's well spelled out which ones that you are eliminating. And once we get down to days 5, 6, and 7, these are often considered the most challenging days. During days 5, 6, and 7, you can eat as many of the foods as you want, but you're only eating from select groups. And so once we get to days 5, 6, and 7, the core groups of fruit that we'll be eating are going to be apple and pears. So apples or apple juice, even apple sauce that's unsweetened. And the core group of vegetables, once we get to days 5, 6, and 7, are going to be broccoli, cauliflower, kale, any kind of lettuce, onions. These are all listed in your manual. Also, once we're in days 5, 6, and 7, from the protein category, you can have as much fish from these categories. You can have wild caught salmon, trout, mackerel, herring. So you can eat any of those fish during days 5, 6, 7. Core group of fats that we can have during those days. You can have avocados, canola oil, coconut oil, sesame oil, olive oil. And then also, there's a whole list of seasonings, spices, things like vinegars, lemon, lime, ginger that you can also have during those days. So inside of your booklet, as you get to the back of the booklet, you'll find that there's sample menus for day 1, day 2, day 3, day 4 that take you through what's a good menu plan for that day. There's also lists of recipes in the back of your 10-day guide. And I know that it's been really successful for patients to spend some time ahead of time planning, looking at these recipes and choosing, okay, when I get to day 4, this is what I'm going to eat that day. And 5, 6, 7, these are recipes that I'm going to follow. After we get through those days 5, 6, and 7, then we slowly begin to add foods back into our diet until we get to day 10. And day 10 is where we've created a clean slate. And what I recommend that you do once we get to day 10 is that if there's foods that you've always wondered, do I have a sensitivity to? May I be allergic to those foods? Just slowly add those back in, because you'll be able to tell pretty clearly at that point if you add, let's say, wheat back in, if you feel bloated afterwards, or if you get cramping, or if you add dairy back in, if you feel more congested. And it's a really good chance, without going through a whole comprehensive food and environmental sensitivity test, to find out if you may have allergies or sensitivities to food once we get to that day 10. So some steps that I recommend as we're leading up to the start of this on Sunday is, the first thing is just make sure to take this 10-day program guide out and read through it. It's really well put together. I think that you'll find it very easy to follow. Second step is just prepare your list of foods. So plan ahead. If you're going to go shopping, we started this on Sunday, so give us Saturday to kind of get prepared, so that once Sunday starts, we're not quickly trying to get everything organized. Third step I recommend is that if you're somebody that does drink a lot of coffee, is used to having simple sugars, energy bars, instead of waiting until Sunday to just eliminate those, start now. Maybe start replacing some of the coffee with green tea. Start reducing the amount of sugars that you're eating, so that it's not as much of a shock to you when we start this on Sunday. The next step, and this is something that, and maybe if Kate, if you're on that chat that I can't see right now, she can put it in there, is start to register for what's called the Clear Change Program at clearchangeprogram.com. And what this is that when you go to clearchangeprogram.com, you'll see that you can register for the 10-day detox program. And I recommend that you do this Sunday morning, because you'll instantly receive an email that describes what to expect for day 1 and some tips for making day 1 successful. And then when you wake up on Monday morning, day 2, you'll have an email in your inbox with tips for day 2. It'll lay out for you exactly what you're eliminating from the foods on day 2, how much of the medical food you start taking day 2, and it takes you through each of the days from day 1 through day 10. So you're going to want to make sure on Sunday that you sign up and register for it at clearchangeprogram.com. And then the last step is that as you've been picking up your detox kits in the office, Kate's been giving you these metabolic questionnaires. And please fill that out before you do the detox and get it back to us. And then after you complete this detox, we're going to also have you fill one of these out so that you can get an understanding of, like, these are some of the things that really shifted as I went through those 10 days. Now, we want you to succeed with this. As an office, I'm doing the detox. My wife's doing the detox. Kate's doing it. Madison's doing it. Lauren's doing it. We're all doing this together. So if you have any questions as we're going through from day 1 to day 10, you can, of course, reach us in the office. You can call us. You can email us. I'll be checking in with those of you that are in for appointments during that time to see how it's going, to see if you have any questions. Our goal is that we all get through this successfully and really get a good forward momentum going into the year 2021. Once we complete this detox as step 1, the next 2 steps that we're going to be doing in the office is the class we're going to do in February called Know Your Numbers. And what we saw in the year 2020 is that some numbers became really important, like knowing what your vitamin D levels are, knowing what your body's inflammation is with CRP, knowing what your body mass index is, knowing diabetic numbers. But what we found with a lot of patients is that they had these tested, but nobody ever told them what their number was once they were tested. And if they did know what their number was, they didn't know what to do with the number. Like, what did it mean? How do they make changes to make sure that they are increasing their levels of health? So we're going to do a class on that, understanding what are the most important health numbers, understand how to get those tested, and then what do they mean and how can you make a difference with those? Because we have this expression that we don't guess, we test. And once you test, you can make a change based upon what that test shows. The other class we're going to do is a weight loss class, because once you go through this detox, we find that it's just a great jumping point to lead into weight loss if that's something you're interested in. So if either of those classes are something that you'd like to participate in, you can message in now, and hopefully Kate can see this and she'll get back to you, or just let us know when we see you in the office next time and we'll get you signed up for those as well. So I want to, again, congratulate all of you. As I prepared for this presentation and just spent some more time going through this detox, I've done this myself probably 10 times in my life. And this year in particular, I'm really excited to be doing it with you. I'm excited doing it with Mandy. I think there's never been a better chance for us to really kickstart a new year after what we all went through last year in 2020 to make this our best health year yet.